Hi everyone, my name is Jamie Parks. For those of you that don't know me, I've been a nurse for about 4 years at this facility, so I have a very strong passion for caring for patients with mental disorders. So today I want to implement a strategy that involves building a rapport with patients so that they can effectively communicate with us and we can create individualized care plans based on their needs. So according to the World Health Organization in March of 2023, approximately 280 million people in the world have been diagnosed with depression. That's a pretty significant number, which just means that as healthcare professionals, we will more than likely see patients with depression every day. So that's the importance of this strategy, is to be able to use this every day and really get to know our patients. So also, according to the World Health Organization in 2023, one of the biggest barriers to effective mental health care for patients is the lack of training that healthcare workers have to communicate effectively with them. So that's the whole premise of this training, just so we can learn how to communicate better and really build those relationships with patients. So that way they're set up for success when they go home too. So according to a study written by Alyssa Schaefer with the American Psychological Association, one study in 2019 found that an estimated 70% of patients lie about their personal life, whether that be symptoms of depression, risk of suicide, drug use, all of those types of things, because they're worried about what happens if they tell the truth. So that is why it is so important to build the relationships with these patients so that they are truthful and we can really build that relationship, let them know that we care, and then that way we can implement individualized strategies for these patients. So, first of all, I just want to thank everyone for watching this video. I really think that we can really make a difference in these patients' lives. Within this training, we're going to talk about effective communication skills to build that rapport and get to know these patients. So, according to the Family Medicine Interest Groups in 2023, these are their strategies to help build that effective communication with patients. So, the first step is to minimize distractions when communicating with patients. By minimizing distractions and preventing interruptions, it just lets our patients know that I am here to listen to you. I really want to get to know you and really open that communication line. So the next one is to engage in active listening. So that is paying attention to the patient's verbal and nonverbal cues as well as our own. So with nonverbal communication, we just need to have an open body stance, so no crossing your arms, just really being open and nodding, letting them know that you're listening, and then maintaining eye contact if that's appropriate in their culture. So another helpful tip to building that communication is asking them questions about their personal life rather than just their medical illness. So instead of just saying, what's your symptoms, how long have you felt this, what's your treatment in the past, while that's all important to know, it's also important to get to know them as a person, whether that be where they're from, their family, their job, anything like that. That just lets the patient know that you care about them and you really want to get to know them as a person rather than just as their illness. So, and then the last thing that they say is that just to ask open-ended questions that really prompts communication for them to keep talking and keep going rather than just saying yes or no. That kind of cuts off the communication with that. So treating depression is not a one-size-fits-all. That's why we need to build those relationships with patients so that we can really get to know them and treat them effectively. So after watching this video, there will be a sign-in sheet for you to sign saying that you watched this. And then within the next month, all employees will need to meet with their supervisor to see and kind of figure out a game plan for how they can implement more strategies to communicate effectively. And then according to Ackley et al. In 2017, it's important to learn through frequent repetition and follow-up sessions. So in 3 months, we're going to have you follow up with your supervisor just to see how it's going and reevaluate a game plan. So, and then one last saying for you to take home with you is the famous saying by Theodore Roosevelt: nobody cares how much you know until they know how much you care. So really get to know these patients, let them know that you care, and then save some lives. So thank you.